Ever since we started going live today, I did not even know.
Yeah, 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 yeah. Yeah, I've been watching my friends and then they make me laugh and feel good. It feels like it feels like today is a Friday, man. It feels like a Friday. But no big worries, no big worries. You guys come for another day. Let me get this tune. When I listen to this tune, when I listen to this tune, I feel good. Yeah, let me drop it again. Let me drop it and let me tell you, my people, that it's a good day. It's a good day. 4:30 p.m. is my time. Always 9 p.m. at Atlanta, Georgia. Always midnight at the Asian countries. Big up everyone who is coming in and who is watching. Today we have started some issues concerning our friends, our mothers, and it's a good day. It's a good day that we do something else. I promise today we'll do hypertensive disease in pregnancy, and I'm here, my friends. I'm here, my friends. You know what we do? We talk about mental health. We talk about everything that health entails health. We talk about everything that entails health. So wherever you are, wherever you are chilling from, no worry yourself. No worry yourself. Benjamin the wise guy is here for you. Benjamin the wise guy is here for you, is here for everyone. So my people, how are you doing? My people, how are you doing? I think you are fine. Everything is doing okay. And we are, everything gonna be alright. Yes. How are you doing, my friends? If you're coming in right now, you know what you have to do. You tell us where you're watching from and where you are. That one will be a good one. You see where you're watching from and where you are, so that we mingle and we get to expand our social social capital. You know what is social capital. Some people don't know what social capital is, but social capital is a very important thing. As we learn, we feel good. As we learn, we feel nice. Yes. Hey, as we learn, we feel nice. Hey, yeah, welcome, my friends, as we start to learn. Today we will be learning about hypertensive disease in pregnancy. Hypertensive disease in pregnancy. Jamaican uncle is here, my friends. Jamaican uncle in the house. Let's welcome Jamaican uncle. And always, as you come in, don't fail to tell me where you're watching from and where you are from. It makes me know the geographical regions and the diseases that occur between the geographical regions that you are. So welcome, my friend. The song in the background is called the Alila Mama from South Africa. Listen to this. Listen. Hey, my friends. These songs were hitting in the 90s. The 90s were great days. And when these songs were hitting, we used to feel good. We will never forget years of the 90s. So, when we are learning and we relate with something that you can never forget, you know what you feel? You feel better. So, you who is watching where you are, everyone who is here, you are watching me. I'm called Dr. Ben. And you are watching from Kenya. This is Kenya, the capital city of Africa. Bija Grahova. I'm a Kenyan, and sometimes to pronounce some names becomes so tough. But here I can see Bija Grahovac. Brahovac, where are you from? Which country are you coming from? Let me bring people on board. Before we start the topic of today. So, blessings to you, Dr. Benjamin, and everyone in the chat. Blessings to you also, Jamaican uncle. We have our friend who is Bija Grahovac. I don't know which side is Bija Grahovac from. Tell us where you are watching from, Bija Grahovac. Which country are you watching from? Let's read. Let me see what is happening here when let me see what is happening. But now today I don't want disturbances. I have to put this on flight mode so that we cannot, when we are learning, we cannot get every time. Listen, tell them something. Feel nice as you wait for the topic as I'm watching people on board. Let me check this out. Let me check. Uncle Dan, how are you doing? It has been long, my friend. Welcome, Uncle Dan. Big up for you coming to the channel. I'm just welcoming my friends. Here is Bija Grahovac, Jamaican uncle, and have Uncle Dan here. Uncle Dan, welcome to the chat. Tell us where you're watching from when you're coming in. Today we want to talk about hypertensive diseases in pregnancy. You know, sometimes you can be pregnant and then you get hypertension. Imagine you are pregnant and you have hypertension, and it's not a disease that you have. It means that the pregnancy is the cause of your hypertension. So my friends, welcome to everyone who is here. Welcome to the chat. Welcome to my channel, Benjamin the Wise Guy. And if you have any medical question, you know what to do. You pin it to the chat. Let's talk about this question that you have. If you know the song in the background, you have tell me that song. I remember it in the 90s. Songs of the 90s were the pioneer songs. So listen. Uncle Dan's channel. Uncle Dan, I've seen you today. Welcome to the chat. Uncle Dan. Good one, as we welcome. I'm sorting things out so that we can continue with this topic, hypertensive disease in pregnancy. Let's see. Is it a pregnant? No, it's not. Let me put you some. This was South African old songs, yes? South African. Listen to that. Yes. That is a welcoming song to everyone who is in the chat. As we do these things, you know, sometimes we learn and feel nice. Uncle Dan, I'm minister for entertainment. Enjoyment is my thing. I inject enjoyment. The minister, a doctor who injects no drugs but injects some good vibes. A doctor who injects some entertainment, and then your mental health becomes what? Stable. You know, when your mental health is stable physically, you are okay. So today we want to learn about something here, something that is very complicated to some people, to our ladies, to our women. When they are pregnant, they start having high blood pressure. High blood pressure comes in. So what brings high blood pressure when it becomes when you are pregnant? Hypertensive disorders in pregnancy are groups of conditions characterized by high blood pressure, during pregnancy. During pregnancy, they are among the leading causes of maternal and fetal illness around the world. So you as a woman is a breakdance, it's not a breakdance. It's not a breakdance. Those are South African old songs. Now, you can have high blood pressure as a woman, and then your baby dies inside your stomach. We call it intrauterine fetal retardation. Because of high blood pressure, you get problems with your fetus. Your fetus cannot survive, but we manage them. So, types of hypertensive disorders in pregnancy. You have several types of hypertensive disorders in pregnancy. When you have conceived, and then you have a baby growing, you have a baby growing in you, and you are getting up, you are going on a good one. You start having hypertension when you are pregnant. We call it gestational hypertension. It's not that you suffer from hypertension, but because you have the demand, you plus the baby, now you are plus the baby, you start having the demand. So the demand becomes hypertensive crisis. Now, gestational hypertension, and we have preeclampsia. I talked about preeclampsia. I talked about preeclampsia and eclampsia. So when you are pregnant, the demand goes up. The demand goes up because you are not just alone. You are you plus the baby who is growing. So demand goes up, and when demand goes up, very many things happen. So any blood pressure between 140/90, 140/90, systolic 140, diastolic 90, that is high blood pressure, and you are pregnant. That develops after 20 weeks. 20 divided by 5, that is 4 weeks. First trimester is 3 weeks. When you are pregnant, the first trimester is 1, 2, 3. The first 3 months, that is the first trimester. So after the baby is growing, the first trimester, you start having the demands rise. The demands rise. You get that you have problems. You start having hypertension, and you are pregnant. This has happened to very many women, by the way. But now, there is something that I want to talk about when it comes to hypertension. Hypertension in pregnancy is checked on several factors. One factor is organ damage. And how do we get to know that organs are damaging? How FRC is here. FRC, hey, today I've seen you. I was listening to this song that Hillary was. Let me put this song for FRC. FRC, I was listening to this song. That one is the song that I've been listening to when I was at your home, at your live. That one was the song that I was listening to. Now, we are talking about hypertension in pregnancy. So, there is something that I want to talk about. When you're pregnant, you can have high blood pressure, but your organs are not damaging. It is just high blood pressure, but you can have high blood pressure and your organs damage. The eye, the kidney, the liver damage because of high blood pressure. So how do we talk about that? How do they damage? When you have high blood pressure, the heart forces a lot of fluids to get out of the kidney. So that, you see, but now instead of getting out of the kidney, what happens? More things get out of the kidney, like proteins. I drew about the kidney. So the kidney has nephrons, which are the filters in the kidney. So when the blood is being pumped, it forces it. When the pressure is high, it forces even the protein to get out of the blood vessels. Like, let me draw this. Let me draw this, you see. This is the heart pumping blood. It's a schematic drawing that I'm drawing. So check on this. So the kidneys are here. So this here we have something. So this one goes to, I've drawn the heart. Now, if this is the heart, and the blood pressure is high, you see this one has holes. So when it is pumping blood, proteins are not supposed to go out of the veins. If they are not supposed to go out of the veins, what will happen? Proteins will go. And you know what proteins does to when they are in the veins and arteries? They help retain something that is called oncotic pressure, fluid retention, so that you cannot have hypotension. Proteins plus what? Blood pressure and diabetes related on is high blood pressure and diabetes related on symptoms. They are related. Blood pressure and diabetes are cousins. And why? Because of organ damage. When this is Uncle Dan talking, asking that question, how blood pressure and diabetes related on symptoms. If you are diabetic, you know diabetes is insulin resistance. If you are diabetic, your kidney suffers because of infections, because of several things. You may have glycated hemoglobin that are carrying a lot of glucose instead of oxygen. So the kidney gets more infections and works slowly. So it releases something called renin. Renin does what? Renin in turn goes and captures something that comes from the liver that is called angiotensinogen. Angiotensinogen is not active. It is activated by renin that has come from the kidney because you have infection. So the kidney is suffering. So when you have infection, now renin has impacted angiotensinogen, which is produced from the liver. When they impact, they become active. It becomes angiotensinogen 1, and then angiotensinogen 1 is converted by an enzyme in your blood that is called angiotensinogen converting enzyme to angiotensin 2. Angiotensin 2 is bad. It constricts your blood vessels, your pressure goes up. And then there is something that is called aldosterone, which loves water, retains fluid, and sodium. You see, so that is how blood pressure and not aldosterone is for salt, so it retains salt and then fluids are retained, and then antidiuretic hormone is released, so you cannot micturate. Micturate means you cannot urinate. If you don't urinate, more fluids in your blood vessels. And remember, angiotensinogen has constricted your blood vessels because your kidney was suffering and it released renin, and renin activated angiotensinogen, which is brought from the liver. I explained that on one of the videos about symptomatic hypertension and how the kidney is related. So you see how they are related. Diabetes is equals to infections plus several things, plus low oxygen, okay, on the low oxygen on your hemoglobin. It's Joya, big up brother. How are you doing, my friend? It's Joya. It's Joya in Qatar. I know right now it is hot like fire. It's Joya. I know in Qatar right now it's hot like fire. I know. How are you doing, bro? How are you doing, bro? How are you doing, bro? Hope you are doing fine wherever you are. So that is Uncle Dan, that is how they are related, diabetes but there are so many factors. Most people that are diabetic, you will find them being hypertensive, but not the reverse. Most people that are hypertensive, they can't be diabetic. But most people that are diabetic, 5% or 75% to 90%, you will find them having hypertension, and you will tell me that mostly the old age, you will find them that someone is diabetic and is struggling with hypertension, or once in a while sugar hypertension comes in, blood pressure goes up. So in pregnancy, you will find that David Diaries, hi Benjamin bro, good. We are talking about, by the way, let me welcome people first. How are you, brother? I'm fine. Let me welcome my friends, man. Let me welcome. It's where, when did you listen to that song? When did you listen to that song? Welcome to the channel, it's where. Welcome David Arisa. Welcome Jamaican Uncle. I know you're walking, morning walk, so good. Uncle Dan has asked a question. Big up Uncle Dan every time, every morning, every evening, every day. Bija Grahovac was here. I don't know if Bija is still here. Bija has left. It's okay, no problem. No, that is all that are in the house. And I've seen today that have a nice day, bro. You too. I have seen today was my first day seeing Efasi Lipenga. Efasi Lipenga, it was my first day, and she's a charming lady full of good vibes, bright lights. Efasi, continue doing the lives, Continue doing the lives. Yeah, Uncle Dan, I hope you are listening and you are watching. India time 7:20 p.m. Here it is Kenyan time. It is 4:52 p.m. 52 p.m. 4:52 p.m. is the time, my friends. No, we continue. We hit the floor and talk about women that are pregnant with hypertension. Hope, Uncle Dan, your question you have understood. I've explained how they are related. Diabetes is a friend to hypertension, but a person who is hypertensive is not a be diabetic. The opposite is not the truth, but I've tried to explain a few things about diabetes and hypertension. Now, we talk about something here that is important. What is this thing that is important? Our women with blood pressure when they are pregnant. Hey, my friend, my green tea loves me. It brings me antioxidants, and that's why I have it whenever I'm doing a live show. Take green tea. Now, very well. Thank you. Let me repeat about it. Diabetes is equals to infections, because bacteria love glucose so that they can grow. So when they love glucose and it is in the system, it goes to the kidney. The kidney suffers bacterial infection, and then it releases something called renin. Renin is a friend to something called angiotensinogen that is from the liver, and it's not active. But even you, when you have your children and they go to they meet the visitor, the neighbor's children, they become active. So renin and angiotensinogen, they are friends. So they become active when they bond, and they form angiotensinogen 1. Angiotensinogen 1 again is activated by an enzyme in your blood vessels that is called angiotensinogen converting enzyme, and when it hits, pop, it brings something else that is called angiotensinogen 2, which brings your blood pressure to go up, constricting your blood vessel. Hillary, big up every time. Hillary is here, and Hillary, get this. day I say that me, I'm Dr. Ben, the Minister for Enjoyment. And the Minister for Enjoyment, what do the Minister for Enjoyment inject? He takes a syringe, he puts their enjoyment and injects you on your brain and you feel nice. You know, big up all the people that are here. Hillary, welcome. Uncle Dan is here. Today we are talking about our ladies. But guys, if you are new to the channel, you know what to do. Subscribe and hit the like button. But you know, something else is the important topic of today is what? The important... Hey, yes, I had forgotten something, man. Big up to Jamaican uncle, acknowledging himself that he is a Kenyan and Kenya is the best place to be. Uncle, where you are, we love you as Kenyans, and everyone, we love you as Kenyans. Now, yesterday was a nice day when he said, you know, I'm a Kenyan, I'm an African, I'm a US citizen, and I come from Jamaica, you say. Biology was something else to my Dr. Ben. Anyway, let me enjoy Soweto Express show. Super organic music. This one is called Soweto Express. Listen to Soweto Express. This was what the TBTs, my friend. You cannot hit this and be normal. So the doctor, okay, sorry bro, I'm important work. My father-in-law health problem. We are going to the hospital. Oh, sorry about that. Sorry, okay, sorry bro. Bye all. No problem. But if you can share with me what is the problem, I may be help behind the curtains. I may be of help. You have my number or my email address, David Diaries. Hit me up. Let me get to know what is happening. Maybe I can give you some 1, 2, 3 things to help you and sort you at least to know the know-how of what is happening. So this one is biology was a great thing, but Hillary, you know, Hillary, when your woman, your wife is pregnant, there are those things that you should know. Like there are 3 types of hypertension. 3 types of hypertension. 3 types of hypertension when it comes to hypertension in pregnancy. When it comes to hypertension in pregnancy, just know there is 3 types of hypertension. Gestational hypertension, pre-eclampsia, and eclampsia. So gestational is 140/90. And at 20 weeks, that is 3 weeks plus 1. Majay, how is Majay doing? Greetings, Dr. Ben and everyone in the house. Majay, hello, welcome to the chat, welcome to the platform. You are the best, Majay. Big up every time. Lady from Jamaica. But today we are doing... Hillary says that is Soweto Express. Hillary and It's Joya. Do you remember those songs? I know you remember these songs, Hillary. Hillary, tell me if you remember them. The 90s, man. If you remember the 90s, I used to go to my village, and you know, when you go to the village, you have to vibe like the village. And these were the songs, Buana. These were the songs. These ones. These were the songs, my friend. Let me get another song. As we learn, if you have a question, you ask. As we learn, it's true. There is one that I know you I know this one you will like it. I know this one you will like it. Let me try and find it. Let me find it. So, guys, welcome to the platform. I Today I'm 2 TBT to 2 TTB. Right to the villages where I used to hear these songs. But as we hear these songs, let's learn, my friends. Let's learn. I've said women, when they are pregnant, they have 3 types of hypertension. There is a gestational hypertension. There is another one that is called preeclampsia, and there is another one that is called eclampsia. And we're gonna know what is the difference between. One was the best music for the late father. I want to play it for you. It's where this one my dad used to hear it and used to dance. We had that radio that had 2 speakers. I don't know how it was called, Sony or Sanyo, something like Sony or Sanyo. I know at the village home we still have that kinanda. We used to call it kinanda. You see, we used to call it kinanda. Listen to that. Hey. There was another song from the Tuso. Instead of learning, today we have come to learn something that is called some South African song. Let me get that Tuso before I continue. There is something we are learning here. Hypertensive disease in pregnancy. So, what are the hypertensive diseases in pregnancy? We have categorized them into 3: gestational hypertension, preeclampsia, and eclampsia. And before we go, what will we be doing? We will know the difference between these, and then tomorrow we will know how to manage them. You got it? Now, Uncle Dan, you love Tuso. I know Tuso. It was a hit song. Tuso rombera Tuso, sorombera Tuso wewa. That's why. Well, Tuso rombera Tuso. Uncle Dan, I know that one. That one is the one that you want. Now, if you are pregnant 3 months and then pressure starts to come, you go and take you are feeling dizzy, you are feeling something, your headache, and then you go and find out that you have hypertension, that without proteins in urine, that is called gestational the hypertension, not diabetes. And why is it called gestational diabetes? It is called gestational diabetes because now your kidney is not suffering. It is your pressure is 140/90, but the kidney is trying to hold. It is not suffering. It is trying to hold the heaviness of it. So you don't have proteins in urine. Because when you have proteins in urine, it means that your kidneys are suffering. You see, it means that your kidneys are suffering. I want to play that for Uncle Dan. Uncle Dan, this is yours. Hapo. Gali Mafura. He was called Gali Mafura. I'm still waiting. These ladies used to sing good songs. Now, when it holds, you don't have protein. When you go to a hospital as a pregnant woman, they usually ask, and then your pressure is high, your blood pressure is high. What do they ask for? They ask for your urine. They don't ask for urine. Let me tell you one thing about urine in pregnancy. If you go to the clinic, the hospital as a woman, and then they ask you, can you please give us urine? We do a blood test. We are not testing only for infections. Infection, big up to your less Jamaican uncle Dan say so. We are not asking that because we want to see if you have urinary tract infection. No. Your urine is very important when it comes to ANC, antenatal profile. Your urine is very important. And how is it important? Because it tells us about your kidney function. And how does it tell us about your kidney function? When your blood pressure is so high and you are pumping blood a lot, the pressure is pumping so high, what happens again? What happens is you gotta find some droplets of protein in urine, because they are pumping and they are being pressed out of the kidney and they are going to the bladder, and then you urinate. And that's how we know this lady has a problem. So today we will learn about something that is called hypertensive disorder. So here in gestational hypertension, you are just having hypertension. It means that there is no proteinuria signs of organ damage. No. The blood pressure returns to normal after 12 weeks after delivery. When you have delivered, your blood pressure returns to normal. You are okay, no problem. And sometimes signs and symptoms. Sometimes you may not have some symptoms. Your pressures are just high, but you don't have headache, you don't have dizziness, you are not nose bleeding. Elevated blood pressure detects during antenatal visits. Yeah, the day that you go to the clinic is when you are told, you know what, your blood pressure is elevated. Your blood pressure is elevated. Sometimes you may be having some transient headaches that are going and coming. You see, some transient headaches that are going and coming. And mark you, this is very important, my friends. Signs and symptoms. In gestational hypertension, you may not have any sign and symptom. You may not have any signs and symptoms. You get? When you visit the clinic is when you are told, did you know that your blood pressure is high? Did you know that your blood pressure is high? But you don't have it. Sometimes you feel headache and it goes and it comes back. You see? Mild headache that occurs and then it goes. But you are okay. But after delivery, it goes, because when you are going to the clinic, you may be given some medication and then you are told you will not take them for long. Once you deliver, it's that way. You just know you have something that is called DOC. Some women continue to have high blood pressure after childbirth but didn't have pressure before. Yes, for gestational diabetes, if you continue having the blood pressure after delivery, just know the doctor who was taking care of you did not do a good job. Because after delivery, you should be tapped out of the drugs. Checked some things that are called lipid profile. Checked some things like you should be doing urine analysis continuously to check your kidney. And if there is any complication after giving birth, you be monitored and stabilized after giving birth. So for gestational diabetes, that one, it goes 12 weeks, around 10 to 12 weeks, 13 weeks after you have delivered, it's okay. You stop taking the medication. You see, but we will see, because we have seen there are 3 types of blood pressures in pregnancy: gestational, preeclampsia, and eclampsia. Now, what are the risk factors of these people that have this kind of hypertension? One, fast pregnancy. The people with fast pregnancies, they may, because they are not used, the hormones are running faster. The kidneys are doing work that they have never done, releasing renin, and renin is coming up with angiotensinogen from the liver, combining, because it is a thunderous hormone imbalance in your body, because this person has never had this. Yes, fast pregnancy, multiple pregnancy, triplets and twins. Triplets and twins. Why triplets and twins? Because demand is high, glucose demands are high, protein demands are high. So your pressure may go up. Your oxygen demands are high. Imagine you have 3 people within you. You are eating and you are giving 3 people within you twins. Man, demands. Yes, demands are high. Obesity. Women that are obesity have obese, big bodies. Obesity, they have risk factors of gestational diabetes because of most of them have high lipids. High lipids. When you do lipid profiling, you find that the cholesterols are high. Yes, big bodies and maternal age, more than 20 or less than 35. Between 20 and 35 years, this one is common. This one is common. And family history of hypertension. If you have never had hypertension but you are pregnant, you may have gestational. And complications, one, you may give birth to a preterm. Hypertension can make you to get a baby before the days come. Preterm, below how many weeks? 39, 40. So 35 is a preterm, 36 is a preterm. That is, time has not yet. 9 months, not yet. Fetal growth restrictions. Hypertension can make your baby not to grow well in the uterus because it is restricting several things, very important things that you have. May progress to eclampsia, and this is the complication that we have said if you are not managed well, it may progress to preeclampsia, preterm birth, fetal growth retardation, restriction. Those are the complications of gestational. And we will know. We talked about preeclampsia but today we will know what preeclampsia is. I know if you are a lady or a woman who is watching, you already know what preeclampsia is, and we will talk about it again. So how do you manage this? How do you manage gestational hypertension? How do you manage gestational hypertension? Regular blood pressure monitoring is important so that you know when your pressures are high, go to hospital so that you cannot end up having preeclampsia. You see, urine testing for proteins, very important. I've told everyone that when you are going to hospital and you are asked for urine, you go to a hospital and you are asked for urine, you don't say that you never had an infection. Why are you asking me for urine? No. Your urine can tell us the state of your kidney, because if we do the urinalysis strip in the urine and then we see it is telling us proteins +2, we know your kidney is suffering. So it's not only infections that we look at when it comes to urine. We call it urine analysis. Urine analysis shows us very many things. It shows us sugars. We will go through that one day. Sugar levels, protein, something that is called specific gravity, the other thing that is called leukocytes for infections, the other thing nitrates, bacteria producing nitrates. So when you go and you are asked for urine, don't repel saying that these doctors are confused. How are they asking me urine and they know that I don't have infection? No, your pressure is high. We want to see if the proteins are in urine. And that one will show us the kidney suffering. So that we know it has stopped to be gestational hypertension. Now it is going to be another complication that is called preeclampsia. You see how we go? So how do abina kothajom is egg, soya, chunks, and potato good for weight gain? Yes. If you want to gain weight, abina. If you want to gain weight, what do? Take proteins and take a lot of starch. Take proteins and take a lot of starch. Take a lot of what is it called? Take a lot of rice. Take a lot of cornmeal. Here we call them ugali. Take a lot of potatoes. Eat, my friend. French fries, chips, we call them chips here. My friend, don't spare them. Eat them. When you want to gain weight, eat eggs like nonsense. A day make sure you are eating 4-5 eggs. Soya chunks, potato, starch. Starch makes you have more weight. So if you want to make, I've given you a secret of gaining weight. But if you want to lose weight, reduce starch. If you want to lose weight, reduce starch. So where were we, my friends? Where were we here? We were at something that is called, managing gestational diabetes. And my friends, if you have any question, you ask. If you have any question, you do ask. Regular blood pressure monitoring, urine testing for protein, and I've said why you test for proteins in urine. Fetal monitoring, check your baby. Is the baby kicking, like kicking the legs? Is the baby turning? Is the baby walking in the amniotic fluid? That one is done by an ultrasound. You see, because the baby might not be moving, it may be gone and you still have it. That may bring sepsis and the pressures may go up. Antihypertensive drugs, if become severe, if you have to be given some drugs to balance, because you have high blood pressure. For now, you have to be given some drugs. So these drugs will help your pressures to go up, down. Deliver at term if the mother and fetus remain stable. You don't fasten to deliver the baby. You wait. Now that is normal. That one that we have talked about, that is normal condition. That is normal condition, and the normal condition means it is called, because of the pregnancy you have the high blood pressure, but it has not given you birth, it has been managed. So it is called gestational hypertension. Let's go to the second one. If you are coming in and this is the first day that you are watching me, my friends, if it is the first day that you are watching me, what do you have to do? You have to hit the like button. And subscribe. It's your first day. Don't just swipe away. Subscribe. I don't drink beer. My friends suggest me to drink beer to gain weight. Abina, me and alcohol, we are not friends. So that is your suggestion. Me and alcohol, no alcohol. Me and alcohol, no friends. So don't drink beer. Just take food, good food. Now we have done about something that is called gestational. Let's go to the second one, which is a bit complicated. At 20 weeks, that is 3 months plus like 1 week, or 2 weeks. The first trimester plus you are getting into the second trimester, the 2 weeks. 20 weeks are around 18-20 weeks there. Pressure starts to go above 140/90. And then you come to the clinic, we do burning more calories than usual. Yes, you come to the clinic, and when you are at the clinic, we take your urine and we do the dipstick. We see, protein in urine. We measure, we find that like 300 micrograms per 24 hours. Ooh. The kidney is having a problem. The kidney is being damaged. The kidney is having a problem, and here we are not even at gestational. It has gone to another type that is called pre-eclampsia. It has gone to another type that is called pre-eclampsia. Pre means before, and I'll tell you before what. Just stay tuned. I'll tell you before what. Pre means before. So before something. So before something happens, we have proteins in urine. Meaning your kidney are suffering and you are pregnant. Imagine. Before. I'll tell you what is that thing before. And here, evidence of maternal organ dysfunction like the liver, brain, lungs, blood, or fetal growth restriction. Here you will find that the liver enzymes are high. Sometimes you wake up and your palms are yellow, your eyes are yellow, your kidneys have proteins. your urine. Your brain is suffering because sometimes you feel that you are not okay. Headaches. You feel sometimes you are missing some things. You are walking like you are in. This is called preeclampsia. You know, we started by gestational and now we are at preeclampsia. So, what are the signs and symptoms of this second one? My friends, if you have any question, don't just listen to Dr. Ben. You know me, as people call me, Dr. Benjamin. Dr. Benjamin. Dr. Benjamin is Minister of Entertainment, Minister of Information, Minister of Enjoyment. And Minister of Enjoyment, as in Minister of Enjoyment, injects you with information. What do you get? You get enjoyment again. Eh? You get information and you get enjoyment. So let's interact, my friends. Leave me a question, inject you with enjoyment. Give me a question, let me inject you with information. You see that? You see that, my friends? Very important. Now, when you have preeclampsia, we have come from the normal, which is gestational, and we are at this one that is called preeclampsia. You see? So when we are at this one that is preeclampsia, what do we have to say? What do we have to say? Guys, just a minute. Give me just a minute. I thought something here. So that is it, my fellow friends. We have started from the normal, which you don't have organ damage. You are okay. You don't have any organ damage. But now we are at another one. That here it is 140/90, and you have protein in urine, which suggests that the kidney is suffering and the blood pressure is high. The liver has damage somewhere. Sometimes you wake up with yellow eyes. The brain is suffering because sometimes you get forgetful. You have seen women that are pregnant and they start being forgetful, and there it's called encephalopathy. You start getting confused, and your enzymes are in the bodies are high, and you are pregnant. So what are the signs of symptoms that you have got to this second one that is called preeclampsia? And preeclampsia means just before something. Pre means before. Before something bad happens. Welcome, my friends. Tune up to Benjamin the Wise Guy. Don't just watch, hit the like button and subscribe to the channel as we see before what happens. And pre-eclampsia means before eclampsia, and we will see what eclampsia is. So let's get to see the signs and symptoms of eclampsia. These are persistent headaches, blood vision or flashing lights. Hillary, I beg from Saviourman Premier, Brenda Fasi kidogo. Brenda Fasi kidogo to Kilan. He's saying Brenda Fasi kidogo to Kilan. You know that? So let's talk about that thing that is called pre-eclampsia. Signs and symptoms. Where Brenda Fasi? You from Brenda Fasi? You for Brenda Fasi, I'll give you some Brenda Fasi. Now, the signs and symptoms are persistent headaches, blood vision or flashing lights, swelling on the face and hands, swelling on the face, pain in the upper. This is your abdomen. This was the abdomen. So, right abdomen, right upper, epigastric pain. Some people, when their pressures are high, you feel that they are here, pain, you know pain, Hey, me, you are Brenda Fassi. You for Brenda Fassi, I'll give you this one.
My name is
I'll give you this one. Who is that? T Beauty. T, the beautiful one. Yeah, you know, when you see a beautiful girl and you are a man, you should call this beautiful woman as it is. Just calls a beautiful woman at hey beautiful, no, you tone down. Hey, you respect the lady who is beautiful and you call that lady T beautiful. How are you doing? Brenda Fassi, oh, Mabenuju, Utunzi. That one was Brenda Fassi, my friend. Brenda Fassi, may your soul be in peace wherever, rest in peace wherever you are. You really made us proud. You really made our youth, our young generation was so nice. So let's talk. We are talking about preeclampsia. Remember, we are talking about three things. When you are pregnant, you have three types of hypertension. You have three types of hypertension. One type of hypertension is called gestational hypertension. Normal. With the drugs, everything is normal. The second one is called preeclampsia. Pre means before eclampsia. So be tuned as we get to know what is before eclampsia. What is that is called eclampsia? Because you cannot just say before pre-eclampsia and you say that is the name. No. That one was for Hillary. But let me play it a bit, Hillary. Hillary, you know you have some taste of good music of before. Listen to that. It's a placenta. yes, it's a placenta. Okay, T Beauty, okay. I'm just guessing now. No, it's not a placenta. It is not. Unfortunately, it's not. Before, let me rewind. You are pregnant, the first trimester, going to the second trimester, you start having hypertension. It is divided into three: gestational hypertension, preeclampsia, and eclampsia. So we know body walking exercise. Walk good. It's a condition. Yes, it's a condition. Let's stay tuned and get to know that condition. So, what are the signs of preeclampsia? And preeclampsia is categorized by protein in urine, signifying that, showing that you have end organ damage when you have end organ damage when you are pregnant, like the kidney is suffering. T Beauty, my blessings, dear friend. Yeah. So here you'll get persistent headaches, blurred vision or flashing light, swelling of the face and hands, pain in the upper right abdomen and vomiting, reduced urine output, sudden weight gain, and high blood pressure. Those are the signs. Persistent headaches, blurred vision. You feel pain on your stomach. You can think you have acidity. The pain on the right upper quadrant. Reduced urine output. I know it got something to do with pregnancy. Yes. Sudden weight gain and high blood pressure. In pregnancy, you have high blood pressure. And the risk factors of the people who have this are first pregnancy, you had previous preeclampsia, chronic hypertension, kidney disease, obesity, multiple pregnancies, autoimmune disease like arthritis, lupus, all those, maternal age of 35 years, of more than 35 years. You are more than 35 years and you have pregnancy, you can get that. It's a risk factor. It's not you can get. you are at risk of getting. So the complication is you can get into eclampsia. You can get into eclampsia, that thing that we are talking about. Stroke, you can get stroke. You know, getting stroke is a complication. Kidney failure, you can get kidney failure. Liver damage, placenta abruptio. Hey, when you have high blood pressure, your placenta can detach from the uterus, the muscle part, and you start bleeding. You see, disseminated intravascular coagulation, you can have that condition. Disseminated intravascular coagulation only means, this means that a disseminated intravascular coagulation means you are bleeding and it's not stopping. You remember we learned about how blood coagulates and cannot coagulate when it's in your body. And then there is something that is called HELP syndrome that affects the lungs, the liver, and then you get a condition called peritonitis. We will learn about HELP syndrome. No worries. It is mostly in women that have high blood pressure. You see. So you who is here, who has a question up to there? Who can guess now what eclampsia is? Who can guess now what eclampsia is? Who can guess what eclampsia is? And someone to get right. Now, how can we manage pre-eclampsia, before eclampsia? Frequent BP monitoring. You give some drugs like labetalol, hemifidepine, the hypertensive drugs that we usually give. Magnesium sulfate or prevent seizures in severe cases. Monitor fetal well-being. You check the fetus how it is doing and deliver it. Delivery is the definite treatment for indication. Now, who can guess what we are now headed? The complication that we don't want to talk about. We don't want our mothers to get into that complication. We don't want. We don't want our mothers to get into those complications. Who can guess what eclampsia is? Hey, mama unguso, kalani ima unguso. I love this song. As you are watching me dance and laugh with me, do this, do that, to the left, to the right. Still waiting to a person who knows what is called preeclampsia. Man, who enjoys music like this dog, man? Who enjoys music like me? Someone tells me one for the road is not good, is good. One alcohol for the road is not good. I'll always tell you, all music for the road is good. Music is my alcohol. Release. Women who are pregnant get cancer. No, women who are pregnant cannot get. Is that cancer or Caesar? Cancer. No, if you don't have cancer, no, you cannot get cancer. Hey, where were you those days when we were learning and laughing at this? Yes, it's a complication in pregnancy. It's a complication in pregnancy, and this eclampsia is something that is called. Let me give you this story. You have high blood pressure. You have now proteins in urine. It has to do with pregnancy, doctor. Barry walking exercise has got it. A Caesar. Yes, eclampsia is Caesar in pregnancy. High blood pressure that is associated with a Caesar, convulsion. Body walking exercise. Big up yourself. Now I should play your tune. Body walking exercise. I should play your tune because you have just got it. That is the correct thing. A Caesar, convulsions in pregnancy. Where is that tune for body walking exercise? Body walking exercise. It is a Caesar, a convulsion in a. Where is this tune? Yes, this one is Jalil. Jalil is another guy that is. It's time for walking. Yeah, walking exercise. Body, listen. Keep on walking. Walk good. Hey, I say, walk good and walk good. Keep on walking. David Joroge. I was to be a doctor, but I dropped it. Body walking exercise. Respect to you. That is your tune, and I know you love it. Let's walk and walk good. Yes. We have been talking about pre-eclampsia, and body walking exercise has got it. It is converted in pregnancy. So eclampsia is a name suggesting that you have convulsions, a Caesar in pregnancy. A Caesar in pregnancy, a Caesar in pregnancy. So pre-eclampsia, before the Caesar. Eclampsia, now the pressures have gone high until you have the convulsions. David Njoroge, respect driver.
Got something between the mind and belief.
Yes, that is Njoroge. I remember you. Yeah, there is nothing good like music, my friend. Yes, my beautiful people, my nice people, we have got the correct answer, the Caesar. Now, after pre-eclampsia, we have managed it and we have given some medication. Let's keep on walking. David Njoroge, big up yourself, big up your big tune, walking by body walking exercise. You usually tell us walk good and great, body walking exercise. Now, eclampsia is here. Eclampsia is here. The lady has come to the hospital or the clinic and the lady is convulsing. The lady is convulsing there and the pressures are high. This is a state that we call eclampsia, the one that we were preventing to. You see, let's keep on walking. Yes, David Njoroge, let's keep on walking. Yeah, very nice one. So, this one, preeclampsia is complicated generalized tonic-clonic movement that cannot be explained by another neurological condition, but you have headaches, you have convulsions, loss of consciousness, sometimes you lose consciousness, severe hypertension, you have hypertension, protein in urine. You remember preeclampsia, we said it is proteins in urine. But here now, there is another thing that has come in. You've been having high blood pressure until you started having preeclampsia, protein in urine, but now you have the convulsions, which is eclampsia that we were avoiding. Hyperreflexia, you twitch, you get it. Those are the signs that this person is having. This person is having something that is not good, eclampsia. So eclampsia, we have three types of 3 types of high blood pressure in mothers that are pregnant. Gestational, normal. You have given drugs, but after you have delivered, after 12 weeks, everything is okay. Second is preeclampsia, before the convulsions have started. And the last one is the bad one. Now the convulsions are here. You've never had this condition, you have never convulsed, you have never had it, but because of the pregnancy and the hypertension, you start to convulse. But now you will see that you have convulsions, you have severe headaches, you have blurred vision, you have loss of consciousness, you have severe hypertension, proteins in urine, and hyperplexia. You'll see this is called eclampsia. And to the mother, what can it do? You know, convulsions in pregnancy is not good. A pregnant woman can have stroke while convulsing because it damages the brain. It may burst because your pressures are high. It may burst your veins in the brain and arteries. So you will have brain hemorrhage. Pneumonia, sometimes you may inhale some toxins when you are convulsing, and kidney failure because proteins are passing from your kidney and the pressures are high. You see, and the last one, I don't want to name it. You know, I don't like death. No, I don't want to name that. No. Complications to the and to the baby might be born when. That's where men run, because one doesn't know what to do. One enters the emergency room asking for help. Yes, let me tell you, my dear men, and these women undergo through a lot. Even if you are a doctor, me, let me put myself, when your woman is in that labor ward and you are that's why a doctor cannot deliver, and there are a few delivering their women. How? You should be, if you have your woman there, you should be thanking God if everything goes, because our women undergo a lot. That's why sometimes most of the women are short-tempered. You tell them some things and they, because of things that, and the hormones that that moves in their bodies. Fetal distress, prematurity, eclampsia, which is the part of high blood pressure that has convulsions. You may end up having something that is called fetal prematurity, delivering a baby that has not reached 40 weeks. Imagine. So how do we manage? How do we manage eclampsia and preeclampsia? Or anyone who has any question before we go to management? There is something, not even management. Margie B had said there are some women get it and then they go on with the condition after the pregnancy. That one is called chronic hypertension. It exists before pregnancy, or it is diagnosed before 20 weeks of gestation. Before 3 months, you start having hypertension. That one is not gestational, it is not preeclampsia, it is not eclampsia. Eclampsia and preeclampsia, they are diagnosed and gestational at 20 weeks, 3 months, going to the second trimester. Only a weak man will run. Hey, T-beauty. We can, no weakness at this point. There is no weakness. People run, my friend. People stay away. You are being called to sign documents for the delivery, and you don't want even to go to that labor ward. So when it comes to this moment, don't say weak men. Everyone becomes weak and weaker. Persist beyond 12 weeks of postpartum. So after you have delivered, after 12 weeks, you still have the problem, and the complications might be superimposed preeclampsia, placenta abruption, heart failure, stroke may be there, fetal growth retardation. This is called chronic hypertension. So if Marge, if you are still here, I want you to know that we categorize them into four. So if someone has delivered and it's after 12 weeks, just know it's chronic hypertension. And most of chronic hypertension, they start before the first trimester. You are pregnant, the first month you start having hypertension. That is chronic hypertension. That is not gestational. It is not gestational. Or either you had it and you didn't know, so it got diagnosed when you went to hospital, when you started the clinics. You see? So how do we manage? Regular antenatal care, safe antihypertensive medication during pregnancy, close fetal surveillance, planned delivery depending on the maternal and fetal situation. Here, after the seizures, you give medications and then you plan delivery. If it is above the second trimester, you plan delivery. If it is at the second trimester, admission, and then you maintain until it goes to the third trimester. The third trimester. Those are how many months? 6 months plus. That is what I was waiting. Signing some documents, one just waits. Those documents are not a joke. Yes, signing those documents. David, you know these things. It seems you have gone through them. It means you have gone through these things. Plan delivery depending on maternal situation and complication. You don't wait. You don't wait. So everyone who is watching, anyone with a question, because now we know there is chronic. We have talked about how many things? 4 things. We have talked about 4 things. We have talked about something that is called gestational diabetes. 2, something that is called pre-eclampsia, before eclampsia. And you have said eclampsia is the convulsive state, seizures, having seizures. And 3, we have said it is eclampsia itself, when you have high blood pressure and eclampsia is there. Oh, I think I didn't hear what you guys talking about. My bad. So when you go to eclampsia, that one you start planning for delivery. If it is above 6 months, you plan for delivery. If it is below 6 months, maintenance, and you'll be admitted until you are stable. And then there is another one, chronic. Now, chronic is the one that is funny, because you know we have said gestational. Gestational means when you are pregnant is when the pressure comes, high blood pressure comes. So gestational diabetes. Here is the coffee cakes. Good morning, doctor. Hi, coffee cakes. Good evening here in Kenya, coffee cakes. How are you doing? We have been talking about hypertension, and I'm giving a recap before I go to management. So, you see, 3 months plus 2 weeks. 2 weeks, that means you are at the second. Doc, my brother faints with witnessing his first child born. Hey, yes, people faint, my friend. That is not, it's not a lie. People faint. I remember my last born. Hey, as a doctor, I was there sweating. Imagine, my last born. I was sweating and telling nurses, please hold on. Hey, please do your work. Hey, imagine. Yeah. So, let me tell you one thing, my fellow friends. So, get this. When we say hypertension in pregnancy, we call it hypertension after 3 months plus 2 weeks. That is second trimester. That is gestational. But this one, after you have delivered, after 12 weeks it goes away, you are okay. But this one that comes at let me say, how many weeks? the 2 months, the first trimester, you are the first month and you have started having high blood pressure. That one is called chronic. Remember the other one we have said it comes the second trimester after 3 months. This one just starts the first trimester and you continue. You are given drug. It means that maybe you didn't know you are hypertensive, or your family you have it and you've never known, even you have it. You see, so you continue having it, you continue having it, yeah, you continue having it until you give birth. And when you give birth, it does not go away even after 12 weeks. You continue with antihypertensive. That one is called chronic hypertension. So you should know that when you are pregnant, our mother has gone to hospital and is asked for urine. We don't check of infections. No. If your blood pressures are high, above 140/90 diastolic, 140 is systolic, the lower one is 90 diastolic. You should know that one thing that is very important you should know. We are not checking for infections. We are checking if you are kidneys or you have end organ damage. So gestational diabetes, the first one, there you will not find anything like proteins in urine, just elevated blood pressure. When we go to pre-hypertensive, pre-eclampsia, the second one, you may get some proteins in urine, but these proteins are like 300 micrograms over 24 hours. Now, headaches are there. Sometimes you don't see well, confusions. But when you go now to eclampsia, what you get is, you will get some convulsions, seizures, protein in urine more than 300 micrograms, and several things. And it may be bad because, you know, your fetus may end up to that one that I don't like to say. Kidney failures, stroke, you may get stroke. But we have also said you can have chronic hypertension for which you didn't know you are having. Once you are pregnant, you start having the kidney issue. And then you come to hospital because you have a headache. That is the first month. This one is not preeclampsia, or it's not eclampsia, or it's not gestational. Gestational mostly starts at 3 months. This one starts immediately at the first month. The first, second month, the first second you have started having high blood pressure. And it is the one that magic that I've said, some women when they give birth, it doesn't go away, it continues. It's because they didn't know. It is called chronic hypertension. Even after 12 weeks after you have given birth, it is still going on. It is called chronic. So in pregnancy, and in pregnancy we have 4 types of hypertension disorders. One is called gestational, 2 is preeclampsia, 3 is called eclampsia, and 4 is called chronic. You see, so in preeclampsia, what we do before it gets convulsions, we give some antihypertensives and we check the organs. We check your high blood, if you have infection, we check if your kidney is okay, we monitor closely and we reduce the high blood pressure. But in eclampsia now, the seizures are there. The seizures are there. What we do, if you are above 6 months, if you are above 6 months, at the 3rd trimester, we can deliver so that you be stable. But if you are below, admission to the hospital, we monitor and we check you. We stabilize you not to get the convulsions or the seizures again, so that your daughter, your son, who you are anticipating to have, may be okay. You see, very important. But if you are above the 3rd trimester and you are coming to hospital with a seizure, your hands are swollen, your feet are swollen, your face is swollen, weakness of the body, you are having headaches, and you are at the 3rd trimester, we just deliver and we put on an incubator and then we admit you until you are stable so that you can deliver. Now, Maje, you understand why some women continues to have high blood pressure. It is chronic hypertension. This one is not gestational. These women tend to know they are hypertensive when they have pregnancy. It is not that they didn't know. It is they get to know when they have pregnancy. Welcome, my friends, everyone who is watching me. If you are new here, raise your hand and come to the chat. Tell us where you are watching me from. Watching the doctor from, and very working exercise. Please continue telling us the nature of being healthy while yes, Barry walking exercise. Yes, Barry walking exercise. Yes, body walking exercise. Continue giving us those tips and good vibes by telling people to walk. Even pregnant women, continue walking. You don't be lazy, because pregnancy needs some exercise. If you do exercise, you feel great. If you do exercise, you feel great and you feel better. Why? Because you are walking and you're feeling great. And as you walk, we say walk good. You are feeling good also. You see. So you are there seated, you are there feeling nice, you are there feeling the greatest way of life. Just know we love all the women, and all the women that are pregnant are special. There is something that is called magnesium sulfate, that is called antitocolytic. It is given at preeclampsia to prevent the seizures. It is given at preeclampsia to prevent the seizures. Magnesium sulfate, and also it protects the baby. So this one, it helps when to stop the seizures, but you have to give antihypertensive at pre-eclampsia. We don't want a mother to get eclamptic. And when you have a seizure, we still have to give you the magnesium sulfate to stop and prevent the seizures that are there. You see, and also prevent injuries during seizure. A mother is brought to the hospital and is convulsing there, throwing everywhere hands, and you are there. You should stop the seizures, my friend, by preventing this mother to get more injuries. So, my friends, you see how I know someone didn't know in pregnancy there are types of hypertension, but today you know, and you can help someone. You can help someone. I've seen a woman coming to a hospital and telling me, you want my urine? Yes. But I'm not having an infection. I went to a doctor some days ago, and my urine was taken, and there was nothing like an infection. And I tell them, no, I'm not only looking for an infection. Some comply, some go, and they are very mad, because when you are treating a patient, you as a doctor treat a patient by telling that patient, this is the reason why I want your blood, this is the reason why I want your urine, and this is the reason why I want this and this. I want your blood pressure so that I can know how I can manage you. I want your urine so that I can know how I can manage you, how I can know your kidneys are suffering, how I can know, how I can know to balance. I want your blood because I want to do a full hemogram to check your infection by lymphocytes, to check your blood levels by hemoglobin levels, to check a problem that you have by checking some things that are called ferritin studies, to check the kind of anemia that you have. You remember we talked about anemia, microcytic, nomocytic, megaloblastic anemia. Those ones, only that thing that is called full hemogram entails all those things. So our mothers that go to the clinics, please comply with the doctors, but let the doctor explain to you. Let the doctor explain to you, because You don't just do tests. You are not coughing. You are not coughing and you are going to hospital and someone is telling you, please, can we do a chest X-ray? And you don't have any symptom. Someone is telling you, can we do a CT scan? And you are not having any sign of getting a CT of being done a CT scan. That's why we are here to give everyone knowledge. We are here to give everyone knowledge and to know what to do when things happen. So guys, today I've talked about 2 hours, 2 good hours, no, 1.5 hours. And I want to ask anyone who is watching, who has any question before I leave? Yes, it's like checking the oil in your car. Very important. Is it dirty? Has it perceived the mileages? Is it still good to continue? Is it holding carbons? No comment. Njoro. We call Njoroge in Kenya David Njoro. So it is important to be screened. And tell our young mothers, our young mothers to go to check. Yes, tell our mothers to go and be checked there. To be checked. It is very important. Some mothers don't go to the clinics and then they come to the hospital late hours. They having convulsions. It is preeclamptic. Everything is a mess. Everything is problems. You start delivering a baby, the mother is passing out. You check the iron levels, even hemoglobin levels. Even you cannot take this mother to theater immediately because you have to find blood. You have to start calling which hospital has blood, negative, positive. Because this mother did not go to any clinic, and this confusion always happened to first-time mothers. Some first-time mothers are good, but some are very confused. Please share these things share the platforms like these ones to them. Let them enjoy the music as they learn, And I said, people don't like listening to medical talks. People don't like listening, but they like listening when you have an experience. Like you see, David Njoroge has an experience. And that's why he's saying, wait until I sign those documents. David Njoroge, let me tell you, it's not you alone. Even ask the doctors. When your woman is in that labor ward walking and screaming, you being near that place is a traumatic event, because now this is your woman and you see. Yes, so it's good to empower people with information. It's good to laugh. And if you are watching me and you are not smiling, when you are smiling, mental health information tell us you are releasing some serotonin in your brain. You stay young and with no stress. So continue smiling as you see the coffee cakes loving beach, as you see Jamaican uncle in the house. Meeting Jamaican uncle, I once fainted. David Njoroge, that's why you are so concerned about this topic. Yes, it is traumatic. It is dramatic, you smile and we talk, we interact. Like you see, David Njoroge has given us a testimony. So you do what? Let's continue interacting. Yes, 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 yes. Good one, good one. Yes, you see Jamaican uncle in the house. Monday is Jamaican uncle meeting you at 9 p.m. Kenyan time. Very big, stay tuned and be blessed. The coffee can be blessed always. And you can see someone else here that is a beautiful girl. Beauty, T-Beauty, always stay blessed. Yes? Stay blessed. The T-Beauty loves kids. Yes, you know what I mean. T-Beauty loves kids. And the topic today is about pregnant women. T-Beauty loves kids, and the topic today is about pregnant women. No worries, no worries. You know what I mean? We see here body walking exercise, and body walking exercise always tell us to do what? To walk good, you know. Body walking. Body walking exercise always tells us to walk good and great, you know. So this information that I'm giving you, you spread it to young others, you know. Yeah, Uncle Dan. Uncle Dan, how are you doing? Now you have the information, Uncle Dan. It's Joya from Qatar. It's Joya from Qatar. Blessings always. Blessings always. Oh, Efa Silipenda, greetings to you was here, and I know she's good. She's good. So everyone who has watched, my time is always 1 hour, and a half. If we go so much, we go up to 2 hours. But today, no many questions are thrown in the table. So I would love to, the man should get counseling before that day. Hey, well, that's why Maje has said, the man should get counseling before that day. But I want to say this. My friend. Men, unfortunately, don't take their women to clinics. Men don't take their women to clinics. When will you get that counseling? Because this is called antenatal care, before you deliver care. Before you deliver care. That is, and you know this woman didn't get a baby alone. This woman got a baby by a man. So you, as the woman is going to the clinic, you should be accompanying this woman to the clinic, so that you get counseling, even you. Not that time that the woman has got the baby is crying out loud at night, the mother is having sleepless nights, and you are there, you are not even helping. It is called antenatal. I recommend that a lot, and it works. Yes, you guys, men, take your women to clinics, antenatal care. Take the most important clinic for a woman to be Nene and Mom. Hi, Nene and Mom. I'm saying this. The most important clinic that a man should accompany the woman is the antenatal clinic, not even the other clinics, because this one is where you are told about the danger signs. This is where you are told about the how to take care of. Yes, this is where you are told how to take care of the baby. This is how you're told how to live with that baby as the woman. Danger signs, you know, the woman is stressed. That's why some women get psychosis, postnatal psychosis, because you are not there for this woman. After the woman has given birth, you are just running up and down out there finding, trying to find what? Money. But the woman at home is having a problem. The pressure was high, so the soul. Simply, where are my people? But the doctor was kind. Oh, yes. You see, read about that. David Njoroge said the pressure was high. So the soldier wants me to move the car, but the question was simply, where are my people? But the doctor was kind. Yes. So you guys get important issues. Very important factors in life. Very important factors in life are: take your woman to ANC clinics. Take your woman to ANC clinics. And when you take your woman to ANC clinic, you will know how to balance. You have heard that I've had something that is called postpartum psychosis. A woman rejects the baby. You see, when a woman rejects the baby, it's because when will you be back on, doctor? Coffee cakes. Back to the labor ward or where? Let me listen. Please paraphrase that word, coffee cakes. When will I be back on labor ward or where? We'll be back on, doctor. When will you be back on? No, paraphrase that. In the hospital, live or where? Today, I may be back at 10 for 1 hour. At 10 p.m. At 10 p.m. See, that is 6. Here it is 6:10 right now. On streaming again. I'll do 1 hour at 10 after Jamaican Uncle. That is 6, 7, 8, 9, 10. 4 hours from now. And then tomorrow again the same time. I usually come at 16:30. Let me give you my time. My time is 16:30 Kenyan time. And questions on streaming, and questions I usually get them at 10 p.m. Kenyan time. So those are my times. 4 hours from now is 1 p.m. here. Yes. So 16:30 is better for you. 16:30 is better for you. 16:30, my time. I'm always on time. Those are my times. So if I don't come at 10 p.m., I wait until tomorrow at 16:30. So let's help our women to prevent postpartum psychosis. Postpartum psychosis is when a woman is having a problem and people say they are mad. Mad is a very bad word to use, because the man is not there for the woman. The man is not there for the woman. You know, when the man is not there for the woman is overwhelmed by, you have just gone through a traumatic event of giving birth, and the man is not there for you. You are doing everything for yourself. It becomes so traumatic. So, any other question, my friends? I think our time is up for now. I will come back at 10 p.m. to check on slap the man, lol. Slap the man. Yeah. You slap, yes. You slap the man. You slap the man. No, you don't. You teach the man on how to do things. So, you guys that are here, I want you to know that these teachings are very important. And share them. Let's meet at 10 for some questions, and then we meet tomorrow for the continuous. So tomorrow we'll be today we have dealt with hypertension, crisis in pregnancy. So we will do some other things like infections in pregnancy. We do infections in pregnancy tomorrow. Tomorrow, be prepared with questions on infections in pregnancy, infections with pregnancy. So guys, bye bye. See you guys at 1 p.m. time of coffee cakes, but my time it will be 10 p.m. 10 p.m. So be blessed everyone, and stay blessed wherever you are. Stay blessed. Thank you so much for tuning in. I love you all. Bye. See you guys.